Let's hit the healthcare real quick.
Yes.
What are your thoughts about where it's going at this moment and going forward?
Well, it is going forward, and I think we'll get a bill through the Congress and to the President this year. I can't predict the date. That'd be really stupid to try to predict the date. But I believe it'll be legislation which will be significant in the sense it'll have a lot of coverage aspects. A lot more Americans will be covered. A lot of people with coverage will have renewed security. Insurance companies will have less power over their lives and their health care because they won't be allowed to have pre-existing conditions being a bar to treatment. I believe it'll enhance choice, the options that people have. I favor a public option. We don't know if that will be enacted.
Is that a do or die issue for you? Do you?
I haven't put on a list of do or die for anything because I want to make sure that we in the end get something done. I have problems where some people want to go against the public option. I also have concerns about what's happening to children's health insurance potentially in what the Finance Committee is doing. But they're not done with their work, so I won't prejudge the result yet. But I believe we can get it done. I think it's essential for health care, even for those with insurance, to have renewed security and stability, but especially for those who don't have health insurance, which I think will make our economy stronger if we cover them. But also has a tremendous fiscal impact. We cannot control long-term national debt unless we begin to tackle, begin is there the operative word, it won't happen quickly, but begin to tackle the main driver of debt, and that's healthcare costs. You can't talk about preserving Medicare for future generations unless we begin to tackle the costs. So a lot of what we've been stressing is the cost control aspect of this, enhancing choice, and also finally putting into our law provisions to get us to more prevention, higher quality. We shouldn't settle for what we have now. A lot of good parts of our system. We have great hospitals and doctors and nurses and entities and parts of our healthcare economy that work pretty well. But the parts that are bad, like pre-existing conditions, like people not being covered, like charging women too much for mammograms, they're not only bad, they're morally suspect in my judgment. We have to take action now to improve and to fix what is not working and to preserve what works. We have a kind of a dual system now. We've got a lot of mostly private coverage in our system. That won't change. But we also have a lot of public coverage, Medicare, Medicaid, VA benefits, VA healthcare. So,
tort reform should be somewhere as part of this bill?
Well, we can have a long debate about what that means. I don't believe that in the end there'll be the kind of so-called tort reform that Republicans in Congress talk about. I have a different point of view on what that all means. It doesn't appear that will be part of what the Finance Committee does, but we'll see. We got our bill done in the middle of July. We're waiting on the Finance Committee now.